Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Susan Main, the director of the Center for Food Safety and Applied Nutrition at the Food and Drug Administration, about new guidelines the agency has released for reducing sodium intake by asking food manufacturers to reduce salt in their products. Let's listen.
Susan Main, thanks so much for joining me.
It's my pleasure to be here with you today, Stephanie.
So research tells us that we consume 50% more sodium every day than recommended. For kids, it's nearly 100%. So what are the health impacts of too much sodium in our diets?
These high sodium intake levels are really concerning because excess sodium is a key contributor to high rates of hypertension, also known as high blood pressure, and cardiovascular disease. And hypertension is epidemic in the US, and it affects more than an estimated 100 million adults, which is approximately half of our adult population. Hypertension is also associated with a whole array of other health conditions, negative health outcomes, including heart disease and stroke, vision impairment, cognitive decline, sexual dysfunction, complications in pregnancy, and kidney disease. So with these two major causes of death, heart disease and stroke, over 800,000 people died from that in 2019. So that's a big public health impact. And we also know that these diseases disproportionately impact racial and ethnic minority populations and result in hundreds of thousands of lives lost and billions in annual healthcare costs. And just a few statistics that I think drive this home: the medical costs for hypertension alone are estimated between 130 to 200 billion per year and are projected to increase to more than 220 billion by 2035.
That's staggering. But by reducing salt intake, we can make a dent in that?
That's what all the science indicates, that sodium reduction will reduce hypertension, which will reduce all the different chronic diseases that I highlighted to you, and that enormous public health impact.
Mm-hmm. So you just published a recent guidance on sodium intake. Can you tell me more about it?
Certainly. The guidance provides the food industry with short-term voluntary targets for sodium in a whole variety of processed, packaged, and prepared foods. So all in all, our targets are aimed at 163 categories of foods, and they're designed to gradually reduce sodium levels in the U.S. food supply. So the goal is for our targets is for industry to meet them in 2.5 years. We also know that sodium plays a role in food technology and food safety. Therefore, we recognize this is not a change that can happen overnight. It will require an iterative approach that supports gradual reductions in sodium levels broadly across the food supply over time. This approach will also allow consumers' tastes to adjust and result in better health outcomes for consumers in the U.S. And importantly, the approach has been designed in a way that no one company or category of food is singled out or scrutinized. So the current targets are intended to support reducing average sodium intake to 3,000 milligrams per day, which is about a 12% reduction from current intake levels for sodium.
And that still wouldn't be down to the daily intake limits that we already have, right? So how would we get there?
That is correct. The current recommended upper limit for sodium intake for adults is 2,300 milligrams per day. So this will be an initial step in an iterative process to reduce sodium broadly and gradually across the food supply. And we expect that after this first round of targets, there would be additional targets that we would put forward in a few years to continue to try to put progress in gradually reducing the amount of sodium in the food supply. The other comment I'll note is while it wouldn't get us down to the levels that we're targeting, 2,300 overall, Even modest gains, like what we're proposing here, to come from 3,400 to 3,000, could have substantial public health impact.
So the guidance is voluntary. Is it really voluntary? And how do you get companies to comply?
So the guidance is voluntary, but what we've seen is that we fully expect that industry is going to be striving to meet these targets. Many of the members in industry that we have spoken to have indicated they really want to do sodium reduction, but what's critically important is that everybody comes along with them so that we have a level playing field and so that consumer tastes, palates can adjust. So we've heard loud and clear industry really wants to deliver the types of foods that consumers are seeking. We hear that consumers want to reduce sodium, they want to buy healthy foods, but the goal here is to put out these targets that can really level the playing field so that we're all looking at the same numbers across the food industry. So that's what we expect. The other thing I can mention is that we have seen this voluntary approach that has been very successful in other countries. So it gives us the flexibility to continue to adjust the targets in the future, to learn from what happens over the next few years using this voluntary approach. But that is the approach that has seen success in other countries.
So you've called this one of the most important public health interventions in a generation. Why does the federal government have to get involved?
I think the main reason the federal government needs to get involved at this point is because consumers have been wanting to reduce sodium, but they found it very challenging to do so. And some of the reasons for that are that currently about 70% of the sodium that we eat comes right from processed, packaged, and prepared foods. It's not the sodium that the consumer is adding at the table or the sodium that the consumer is adding when they're cooking. It's the sodium that's in those foods that we're eating on a regular basis. The other thing I'll comment on is a lot of those sources of sodium are hidden from consumers. It's on the nutrition facts label for most of these products, but they may not be thinking about looking at it in all circumstances. And so foods that may not taste salty per se often contribute a lot of sodium to our diets. And so that's why the federal government really wants to get on board to help address this problem, because we haven't seen the types of progress that we've wanted to be seeing over the last many years, despite knowing that the US population is over-consuming sodium.
So if these products are reformulated to cut salt, is there a risk that they will just add more sugar to products to make them taste good?
So in terms of that, it really would depend on the individual food. But what producers can do is in many cases simply add less sodium. That's one option on the table for certain food commodities. And there's other alternatives as well that we have certainly heard a lot about. For example, one particular alternative we have heard a lot about from the food industry is potassium chloride as an ingredient. And that can be used as a partial substitute for sodium chloride or salt. And so last December, we put out a final guidance regarding an alternate name for potassium chloride that would effectively allow industry to use the term potassium salt when they use it on those food labels, which may help consumers understand that potassium chloride is a salt substitute when listed as a food ingredient on product packages. I will also add that potassium is an underconsumed nutrient of public health significance. And because of that, it is required to be included on the nutrition facts label, as is added sugars.
Terrific. Are you worried particularly about children here?
We are worried about children, and the sodium intake data in particular for children are really concerning. And that is more than 95% of children between the ages of 2 and 13 exceed the recommended limits for sodium for their age groups. And those consequences can track into adulthood and influence later health outcomes. I've already mentioned how common hypertension is right now. 100 million American adults have it. But even in children, the tendency for blood pressure to rise with higher sodium can occur. So you're going to see likely higher blood pressures even in children with higher sodium intakes. Also, studies suggest that the preference for sodium is affected by early life consumption habits, and that can extend into adult years. Although, as I mentioned earlier, palates can also adjust to lower sodium in food. So yes, we are worried about children. And the other thing I'll say is that we're also concerned about the impact of the pandemic on children's obesity trends and their nutrition more broadly. the data are really concerning. So yes, FDA is concerned about children's health and children's nutrition. And reducing sodium in foods eaten by young children is one really important step we can take for better nutrition for children.
I guess one recommendation also is to not to eat the foods that are highly processed, but I guess this dovetails with that.
Well, I think this is all consistent with the dietary guidelines. And I think the goal of the dietary guidelines is really to drive people towards those types of dietary patterns that contain the underconsumed food groups. And we see it. It's, our population underconsumes fruits and vegetables. We underconsume dairy products. We underconsume whole grain. These are all widely underconsumed in the U.S. At the same time, we're eating too much sodium. So, and other nutrients of concern, added sugars as well. So the goal here is really to address, in this case, the problem of excess sodium. And we think that these steps will really have an important, meaningful impact on population intake of sodium.
Mm-hmm. And aside from processed foods, I understand that somewhere I might get salt that I wasn't aware of is in restaurant food.
That is correct. Restaurant foods can be a substantial contributor to sodium intake. And so an important step that consumers can take is when they are eating out, they can ask for information about sodium content of the foods that they are purchasing. Under the menu labeling laws, basically what it says is consumers can ask for additional nutrition information upon request. And for the larger chain restaurants, they need to provide that information to consumers. And sodium is one of the key nutrients that is part of menu labeling to be declared to consumers. So we do encourage consumers to look at sodium intake, not just in the packaged foods from the grocery store, but also in foods that would be consumed away from home.
Well, Susan Main, thank you so much for this conversation.
Great. Thank you, Stephanie. And I hope this raises a little bit of awareness about the importance of sodium reduction and what we can all do together to get healthier outcomes for children and for Americans more broadly.
Public Health On Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.